Hello, I'm Jeffrey Potter. I'm a chiropractor doctor. Just wanted to give an update. I know I gave a video earlier. I just wanted to provide maybe a little more information on how I approach uh, each of the patients that come in my office. They needing chiropractic treatment. Sometimes patients are curious, what treatment is necessary. Um, Whenever I suggested in the last video about point of entry care, well, I just have to say that maybe explain that a little bit better. So, chiropractors are very common on the market, and so you're going to have a lot of this basic care approach. So, they're just not going to be there's not much involved with each visit but your basic chiropractic adjustment. There might be a 10-minute massage uh, with a little extra out of pocket insurance is not going to cover. And then they'll come at you with maybe some over the counter frequencies. And I write about this on my website so that you could better understand. So when I do an exam, I can learn, do you need professional frequencies that do a marvelous job? These are the standard physical therapy modalities that are part of getting control of a malalignment or a mispositioned pinched nerve, subluxated type joint problem. So chiropractic care, yes, is very helpful, but there is also a needed physical therapy treatment. And I just noticed that a lot of chiropractors, if they're not going to provide those physical therapy frequencies, they're real slow, or maybe never recommend that you would seek the physical therapy treatment outside of their office during the course of getting your chiropractic treatment. So this is something that puts a patient at a disadvantage, and I would beg to differ with these practitioners. I think that is very extremely necessary, as the research has been proven that these types of additional modality adjunctive treatment is very necessary with the adjustment to best maximize and bring the patient to their deserved wellness, so that you could minimize needing further investigative expensive approach like an MRI. Especially with all of these insurance companies, you have high deductibles, so you're looking at high costs out of pocket, and really all you're wanting is some proper treatment and relief so that you don't got to get into high costs. So most cases, 87%, 84%, if I approach it the way I have been trained and the research methodology shows to approach you with, it has great results. And so, there's all kinds of theories as to why clinicians would avoid combining the care as I like to do, because the research supports it. And in fact, most patients are going to come to their wellness much faster. They're not going to have to seek a bunch of visits for little relief each visit if we're not going to do all of the care. And then this could drive too many visits and, in fact, may never reach proper results. And then here you are, you hadn't even got the care, you haven't been recommended, and then you're going to go on with the poor results and go get an MRI, and they get into more expense and like an injection treatment that's very risky. It comes with side effects. It comes with more problems as you move on. So, and or possible surgical correction options because you didn't get enough proper care before you went to that level. So unfortunate things like this do happen in the field. And so I just totally encourage, if you've already had chiropractic treatment, you haven't had the proper modality care, because over-the-counter TENS, electrical fields, and heat pads and things like this are over-the-counter. And this is what many clinicians I've seen do. And yet they're not telling you to go pick up the professional frequencies that I also provide. So I highly encourage you, get in. Let's try to do a little consultation, possibly proceed to an evaluation if we find you haven't had that care, and see if that would better turn your problem around, where you don't need to move into those more aggressive approaches I just mentioned earlier with MRI and the surgery and those injections, which are typically going to help the problem a hint. It's not going to bring a bunch of function with it. Although, if you're at wit's end, you've tried everything, obviously that might be the answer, is to move into a surgical option. But first, I know surgeons like to see you exhaust more conservative measures before going into those riskier realms. Anyway, thanks for listening in again, and take care. And hopefully you'll reach out. I'm at a text 281-216-8306, and then if you, I'll respond and give you further instructions from there. Thanks for listening. Bye bye.